Have you noticed that everyone on the internet suddenly thinks they have ADHD? Every scroll brings a new video that says, can't focus, ADHD. Do you procrastinate? ADHD. Lost your keys? Definitely 100% ADHD. But ADHD is much more complex and much more clinically specific than most online content would suggest. So let's talk about what ADHD actually is, how it's diagnosed, and why so many people are incorrectly labeling themselves. What ADHD really is the core symptoms, which is ADHD is attention deficit hyperactive disorder. It's a neurodevelopment condition, meaning the brain develops differently in areas responsible for attention, planning, and impulse control. There's three subsets of ADHD. There's the inattentive type, and these symptoms really include difficulty sustaining focus, losing track of tasks or materials, being easily distracted, struggling with organization, forgetfulness in daily activities, making careless mistakes, and trouble following through, even with good intentions. This isn't sometimes zoning out. These symptoms are persistent, impairing, and lifelong standing typically. Hyperactive impulse type is where the symptoms are feeling internally driven or restless, like you're ran by a motor, excessive talking, interrupting, or blurting out answers, difficulty waiting for one's turn, engaging in actions without thinking about the consequences, physical restlessness, fidgeting, and pacing. In adults, hyperactivity often becomes internal, meaning a constantly active mind more than bouncing in a chair. And then there's the combined type, which is a mix from both of those categories going back and forth. But one thing is crucial: everyone experiences these behaviors sometimes. ADHD is when these symptoms are chronic, impairing, and affect multiple areas of the life. When we think about diagnostic criteria, what clinicians actually look for is a psychiatric provider will follow strict DSM-5 criteria, not a 10-second or 10-question TikTok quiz. Some of the official requirements include symptoms must be present for at least 6 months, not just during burnout, finals week, parenting fatigue, or stressful periods. Symptoms must go back to childhood. ADHD doesn't suddenly start at age 28 or 52 or 48. Most symptoms don't get diagnosed until later, but these symptoms were long there before. Symptoms must cause an impairment in two or more settings. For example, work or school, the home life, social interactions, relationships. This helps differentiate ADHD from stressful situations or situational stress, trauma, or anxiety. And the symptoms cannot be better explained by any other type of condition like depression, anxiety, post traumatic stress disorder, sleep deprivation, stress, trauma, bipolar, thyroid issues, have you, because thyroid issues can mimic ADHD symptoms. This is why self diagnosis is incredibly risky. ADHD overlaps with many other conditions that require vast different treatments. The true diagnosis process includes a full clinical interview, a review of childhood symptoms, standardized ADHD assessments, and screening for other conditions, and functional history in the work, in relationships, and academics. So ADHD is not diagnosed from a single questionnaire, and definitely not from TikTok videos. So why is it so incorrect to diagnose yourself, and why is it so common online? ADHD symptoms overlap with everyday human experiences. Everyone procrastinates, everyone gets distracted, everyone has days when executive function falls apart. But ADHD symptoms are persistent, impairing, and consistent along a lifetime, not occasional. Modern life pushes attentions to its limits. Chronic stress, digital overload, poor sleep, and constant multitasking can make anyone feel unfocused. People mistake brain fatigue for a neurodevelopment disorder. Short form videos oversimplify mental health. Creators often highlight single symptoms that many people relate to. just for likes and subscriptions. Relatability does not equal diagnosis. People want answers for their struggles. Many adults feel overwhelmed, disorganized, or burnt out. And frankly, ADHD seems like an explanation, but misdiagnosis can delay the right treatment. Algorithms reward symptom lists, not accuracy. That's why so many people are watching these videos. What spreads fastest online is what's catchy, not what's clinically nuanced. This doesn't mean ADHD isn't real. It absolutely is. But online environment can blur the line between a disorder and common human difficulty. So, what to do if you suspect that you have ADHD? Number one, if you see yourself in some of these symptoms, I tell you, you're not alone. And it doesn't mean you're imagining things, but the only way to truly know is with a professional evaluation that looks at the full picture: clinical childhood history, mental health, medical factors, and daily functions. ADHD is treatable. People thrive with proper diagnosis and tailored treatment, which includes therapy, coaching, structure, lifestyle adjustment, and sometimes modification. If you're unsure, confused, or curious, reach out to your psychiatric provider. You deserve clarity, you deserve support, and you deserve care that's based on you, not an algorithm.